Every day, an average of 70 Canadian men will be diagnosed with prostate cancer, and 64 Canadian women will be diagnosed with breast cancer. People with advanced forms of these cancers are at risk of bone metastases, which can lead to serious, sometimes debilitating complications.
Bone metastasis with advanced cancer refers to the cancer spreading to an individual's bones. These are quite common, and they often occur in individuals with prostate and breast cancer.
Dr. Tony Finelli is an oncologist at Princess Margaret Hospital in Toronto. As more than 70% of patients with advanced breast or prostate cancer will develop bone metastases, he urges cancer patients to heed the warnings and symptoms of cancer spreading to the bone and speak to their physician about treatment options.
Specific symptoms would include increasing pain or new pain in an area that was not present before. Also, changes in limb function or other bodily functions that may represent bone metastasis progression.
Complications of bone metastases, called skeletal-related events, can include broken bones, compression of the spinal cord, or the need for radiation or surgery.
The importance of early detection and treatment of patients at risk for complications of bone metastasis has been demonstrated in more than one study. We know that bone metastases will progress and have a great impact on quality of life through skeletal-related events. If we can intervene early, we could diminish the risk of this occurring.
Carol Little knows all too well about the progression of bone metastases. Her father was diagnosed with prostate cancer at 58, which later, at 65, spread to his bones.
We were on a ski vacation with the family, and we came in from the ski hill. My father was experiencing quite a bit of pain in his back, and we thought at the time there were back spasms, but he was in so much pain that we took him to the emergency. It was following that incident that we had an MRI performed, and where we discovered that the prostate cancer had gone to the bone.
Prostate cancer, which spreads to the bone, is still prostate cancer, not a primary bone cancer. And that's precisely what happened to Carol's father. The pain worsened, and due to fractures in the spine, he eventually was never able to walk again. At the age of 67, he lost his long battle with cancer.
Complications related to bone metastases can have a significant effect on a patient's quality of life. Pain requiring analgesia, diminished mobility, potentially loss of function. And with these effects, family members are often required to give greater support to those with this significant cancer.
My father is not the type of person to rely on anyone else. He was successful and bright and independent, very active. And for him to rely on others, especially his loved ones that would be the primary caregivers towards the end, was dreadful to him.
There are treatments available that help reduce the risk of developing serious bone complications for those with advanced cancer. So it is important for people who experience symptoms of cancer spreading to the bone, such as bone pain, to speak to their doctor about treatment options.
The two forms of therapy are bisphosphonates, or the rank ligand inhibitor, which is known as denosumab or Xgeva. The commonly used intravenous bisphosphonate is zoledronic acid. This requires time in a chair and an intravenous access. Some patients are not candidates for this because of kidney dysfunction.
Xgeva, on the other hand, is administered once every 4 weeks via subcutaneous injection, and dose adjustment for renal impairment is not required. The most common adverse events were fatigue and asthenia, hypophosphatemia, and nausea. It can cause severe hypocalcemia. Osteonecrosis of the jaw has been reported in patients with denosumab and bisphosphonates.
I wish we would have known what to look for, what the symptoms would be to recognizing that the cancer had spread to the bone. I wish that there was more we could have done for his pain. And I wish that it wasn't as long as it was, that he was in discomfort for the length of time that he was.
The most important message for patients with bone metastasis is to have that conversation with their physician, to discuss with them what options may or may not exist for them. If they receive the care that's available, they will diminish the risk of developing the sequela of pain and bone fractures that can occur with bone metastasis.
For more information about bone metastases and preventing bone complications, speak to your doctor and visit this website.